Prostate cancer. 13 silent signs that can save your life. Have you ever thought that your body might be hiding a deadly threat right now? What if there was a disease that silently grows for years before showing symptoms? What would you do if you knew that identifying the early signs could literally save your life? Prostate cancer is the second most common type of cancer among men, second only to skin cancer. When discovered in time, the chances of cure are extremely high and can exceed 90% of cases. What reason could justify ignoring information that could determine your future? Thousands of men receive this diagnosis every year, many in advanced stages simply because they are unaware of the initial signs. The prostate is a small gland responsible for producing some of the seminal fluid, but when cancer cells begin to multiply in it, danger sets in. The knowledge you'll gain here can be the difference between life and death, not just for you, but for all the men you love. Know the signs, understand the causes, and find out how to prevent this disease that affects 1 in 8 men during their lifetime. The taboo around this subject has already cost thousands of lives that could have been saved with information and preventive action. Let's get started. Shocking truths about prostate cancer that could save your life. Prostate cancer is a reality that many men prefer to ignore, but which can be decisive for men's health. According to international medical organizations, 1 in 8 men will receive this diagnosis at some point in their lives. This alarming number reveals the importance of knowing deeply about this condition that affects millions globally. The small gland located below the bladder plays a fundamental role in male reproduction, being responsible for producing seminal fluid. When cancer cells begin to develop in this region, they can remain silent for years or even decades. This insidious trait turns prostate cancer into a perfect killer, striking unnoticed until it's too late. There are 2 main types: slow-growing ones, which can remain contained in the prostate gland for many years, and aggressive ones, which spread quickly. This variation in the speed of progression makes early detection even more important, before the cancer has a chance to spread. When the cancer spreads to bones, liver, or lungs, the treatment becomes much more complex, and the chances of cure decrease dramatically. Preventive exams, such as the PSA, prostate-specific antigen test, and the digital rectal exam, are able to identify changes long before the appearance of the first symptoms. These simple, quick, and affordable procedures can literally save lives when performed regularly by men over the age of 45. The prejudice and fear associated with these exams have cost countless lives that could have been saved with a simple annual visit to the urologist. Types of prostate cancer. What your doctor doesn't tell you about the dangers. Not all prostate cancers are the same, and understanding the differences between them can be crucial to understanding the risks and treatment options. The vast majority of cases, approximately 95%, are classified as adenocarcinoma, which develops in the glandular cells of the prostate. Even within this predominant category, there are significant variations in cellular behavior that determine the aggressiveness of the disease. Some tumors grow so slowly that many doctors take the active surveillance approach rather than immediate treatment. This strategy involves regular monitoring and intervention only if there are signs of progression, avoiding unnecessary side effects of more invasive treatments. What few doctors clearly explain is that this critical decision depends on an accurate analysis of the type of cancer cells present in your specific case. In addition to common adenocarcinoma, there are rare types such as small cell carcinoma, which accounts for only 1% of cases but is extremely aggressive. This type spreads quickly to other parts of the body and usually responds less to the traditional hormonal treatments used for prostate cancer. Correctly identifying the specific type is essential to determine the most effective treatment plan for each patient. Another determining factor is the degree of the tumor, measured by the Gleason scale, which evaluates how much cancer cells differ from normal prostate cells. Higher scores indicate more abnormal cells and more aggressive behavior, requiring faster intervention and more intensive treatments. This scale is a key tool that guides doctors and patients in decisions about the best path forward after diagnosis. The Russian roulette of men's health. Why postponing appointments can be fatal. Postponing medical appointments and preventive exams is like playing Russian roulette with your own life, especially when we talk about prostate cancer. Many men only seek medical help when symptoms are already evident, ignoring the fact that at this stage, the disease may have advanced significantly. This fear-based or denial-based attitude has devastating consequences that could easily be avoided. Early prostate cancer usually has no symptoms, creating a false sense of security that leads many men to postpone regular checkups. When the first signs appear, such as difficulty urinating or pain in the pelvic region, the cancer has often already gone beyond the limits of the prostate. Each year of postponement can be the difference between a simple treatment with a high chance of cure and a long battle with metastatic cancer. Preventive exams are quick, relatively painless, and can be performed during a routine appointment with a urologist. The PSA test consists of a simple blood draw, while the digital rectal exam lasts only a few seconds and can detect nodules or changes in the size of the prostate. Compared to the physical, emotional, and financial suffering of treatment for advanced cancer, these minor discomforts are negligible. When detected in the early stages, prostate cancer has survival rates greater than 95% after 5 years of diagnosis. In contrast, when diagnosed at an advanced stage with metastases, this rate drops dramatically to about 30% in the same period. These numbers highlight how procrastination can turn a highly treatable disease into a potentially fatal sentence. 13. Telltale signs. Your body is screaming for help. When it comes to prostate cancer, your body frequently sends warning signals before the situation becomes critical. Identifying these signs early and seeking medical evaluation can make all the difference in prognosis and available treatment options. Let's break down each of these signs so you can recognize them if they appear. 1. Pain or burning when urinating. Your body trying to communicate a problem. If the act of urinating, which is supposed to bring relief, is causing pain or burning, it may indicate that the prostate is inflamed or enlarged. This symptom is often mistaken for a urinary tract infection, leading to inappropriate treatments that only mask the underlying problem. Any persistent discomfort when urinating deserves immediate medical attention, especially if other symptoms on this list are also present. 2. Frequent urination during the night. When your sleep is interrupted by danger. Getting up repeatedly during the night to urinate, a symptom known as nocturia, can indicate pressure from the prostate on the bladder. As the tumor grows, it can compress the urethra and bladder, reducing its capacity and causing the constant feeling of a full bladder. This seemingly simple sleep disorder can be one of the first signs that something is wrong with your prostate. Don't ignore it. 3. Presence of blood in the urine. The literal red alert. Blood in the urine, visible or detectable only in laboratory tests, is a sign that should never be overlooked. Although it can have various causes, from infections to kidney stones, when associated with other symptoms on this list, it can indicate prostate cancer. This symptom usually indicates that the tumor is already at a more advanced stage, possibly invading adjacent tissues or the bladder itself. 4. Back, hip, or leg pain when cancer spreads. Persistent pain in these areas, especially if it worsens at night or does not improve with conventional measures, may indicate bone metastasis. Prostate cancer has a predilection for spreading to the bones, particularly to the spine, hip, and femur, causing deep and constant pain. This manifestation usually occurs in more advanced stages of the disease and requires urgent medical intervention to control pain and cancer progression. 5. Unexpected weight loss. Your body consuming itself. Losing weight significantly without changes in diet or physical activity level can be a sign that cancer is eating up the body's energy reserves. This loss usually occurs when the cancer is metabolically active, utilizing nutrients that would otherwise be destined for healthy tissues. A reduction of more than 5% in body weight in less than 6 months without explanation should always be investigated by a doctor. 6. Discomfort in the rectal region. The annoying neighbor. The prostate is adjacent to the rectum, and when enlarged due to cancer, it can cause a feeling of pressure, discomfort, or even pain in this region. Many men confuse this symptom with hemorrhoids or intestinal problems, delaying the search for the correct diagnosis. The persistence of this discomfort, especially when accompanied by changes in bowel habits, deserves complete medical evaluation. 7. Pain. When sitting, when comfort becomes impossible. Feeling pain or discomfort when sitting, especially on hard surfaces, can indicate an enlarged prostate putting pressure on adjacent nerve structures. This symptom is often ignored or attributed to muscle problems, but when persistent, it should warn of possible prostatic changes. The pain tends to worsen with prolonged periods in the sitting position and may temporarily improve with changes in position. 8. Difficulty. Urinating. When flow becomes a challenge. Difficulty initiating or maintaining urinary flow is a classic sign that the prostate may be compressing the urethra. This progressive symptom begins with a weaker flow and can progress to the inability to completely empty the bladder. The resulting urinary retention can lead to recurrent infections and kidney damage if not treated properly. 9. Loss of bladder control. When your body loses control. Urinary incontinence, such as involuntary leaks, can be a sign of more advanced stages of prostate cancer. This symptom occurs when the tumor compromises urinary control mechanisms, affecting nerves and muscles responsible for retaining urine. In addition to the physical impact, incontinence causes significant psychological and social suffering, drastically affecting quality of life. 10. Painful ejaculation, when pleasure turns into pain. Pain during ejaculation is not normal and may indicate inflammation or obstruction caused by changes in the prostate. This symptom directly affects sex life and often leads men to avoid intimate relationships, impacting relationships and self-esteem. The persistence of this symptom, especially when accompanied by blood in the semen, requires immediate urological evaluation. 11. Persistent fatigue, when your body is in silent war. Excessive and constant tiredness, even after adequate rest, can indicate that the body is directing energy to fight cancer. This fatigue is different from normal tiredness, being deeper, not improving with rest, and significantly affecting daily activities. When accompanied by other symptoms on this list, persistent fatigue should be considered a possible sign of cancer progressing in the body. 12. Swelling in the legs or feet, when circulation is compromised. This swelling can be caused by blockages in the lymphatic system, something that happens in advanced stages of the disease. When cancer spreads to the pelvic lymph nodes, it can obstruct the normal drainage of fluids from the lower extremities. Asymmetrical or persistent swelling, especially when accompanied by pain, should be evaluated by a doctor urgently. 13. Recurrent urinary tract infections, when bacteria find fertile ground. Repeated urinary tract infections in men are uncommon and may indicate obstruction of urinary flow caused by an enlarged prostate. Urine that remains in the bladder due to incomplete emptying becomes a conducive environment for bacterial growth. If you are experiencing frequent urinary tract infections, especially after the age of 50, a thorough prostate evaluation is essential. What really causes prostate cancer? Science has not yet identified a single cause for prostate cancer, but several factors contribute to its development. Research points to a combination of genetic predisposition, hormonal factors, and environmental influences that together increase the risk of this disease. Understanding these mechanisms can help in prevention and early detection, saving countless lives. The process begins when prostate cells undergo genetic mutations that alter their normal cycle of growth and death. Instead of following the natural cycle, these modified cells multiply uncontrollably, forming a tumor that can eventually invade nearby tissues. The genetic imbalance that triggers this process can be inherited or acquired throughout life through damage to cellular DNA. Male hormones, especially testosterone, play a key role in the development of this cancer. Testosterone stimulates the growth of prostate cells and consequently can accelerate the multiplication of already existing cancer cells. This hormonal influence explains why androgen deprivation therapies, reduction of male hormones, are effective in treating many cases. Are you in the risk group? Find out before it's too late. Certain factors significantly increase the likelihood of developing prostate cancer, and knowing them is the first step to effective prevention. Advanced age is the main non-modifiable risk factor, with more than 60% of cases diagnosed in men over the age of 65. If you are in this age group, surveillance should be even stricter, with mandatory annual exams. Family history multiplies the risk by 2 to 3 times if your father or brother had the disease, suggesting a strong genetic component. This risk increases even more when multiple relatives have been affected, or when the diagnosis occurred at an early age, before the age of 60. In these cases, preventive exams should start earlier, usually 10 years before the age of diagnosis of the youngest affected family member. Ethnicity also influences significantly, with Black men having the highest incidence and mortality rates from this disease in the world. Studies show that men of African descent tend to develop more aggressive forms of cancer, and at an earlier age than other ethnicities. Genetic, socioeconomic, and health access factors contribute to this disparity that needs to be recognized and addressed. Protective shield. Powerful strategies to shield your prostate. While there is no guaranteed way to prevent prostate cancer, certain lifestyle changes can significantly reduce the risk. A diet rich in fruits, vegetables, and whole grains, and low in saturated fats, has been linked to lower rates of this disease. Foods like tomatoes, rich in lycopene, fish, omega-3, and cruciferous vegetables like broccoli contain compounds that protect prostate cells. Regular physical activity not only helps maintain a healthy weight, but it also regulates hormones and reduces chronic inflammation in the body. Studies show that physically active men are less likely to develop aggressive forms of the disease and have better outcomes after treatment. Just 30 minutes a day of moderate exercise can make a significant difference in protecting against several types of cancer, including prostate cancer. Controlling body weight is especially important, as obesity is associated with more aggressive forms of prostate cancer. Excess adipose tissue produces estrogen and causes chronic inflammation, creating an environment conducive to cell mutations and tumor growth. Reducing just 5 to 10% of body weight already has measurable benefits for the health of the prostate and the body as a whole. It's never too late to act. The time is now. If you've made it this far, you've already taken the first and most important step to protect your health: seeking knowledge. Now it's time to turn that information into concrete action, regardless of your age or current health condition. Prostate cancer doesn't wait, and every day of postponement can mean the difference between a simple treatment and a complex battle. Schedule an appointment with a urologist today if you are over 45 years old or belong to a risk group. Preventive tests are quick, simple, and can literally save your life by detecting changes before they become symptomatic. Your health is not only a personal asset, but a gift to everyone who depends on you and who wants to have you around for many years to come. Share this information with other men in your life: father, siblings, friends, co-workers, breaking the silence and taboo surrounding this topic. Many lives are lost unnecessarily due to lack of knowledge and fear that prevents seeking medical help in a timely manner. Be an agent of change, promoting awareness that can save countless lives around you. Always remember, taking care of your health is not a sign of weakness, but the greatest demonstration of strength and self-love that a man can have. The time to act is now. Don't wait for the appearance of symptoms or the worsening of signals that your body may already be sending. Your life is too valuable to be put at risk by negligence or fear of a simple examination.